recording. Now you'll need to click on continue to agree to be in the meeting as it's being recorded. So please do that. And I also want to let you know that you are muted. You were muted when you entered the meeting. And so you're interacting on chat, so we don't have any background noise. So we'll have times when we're asking you to interact on chat, but also feel free to ask a question to Dr. Wilson as the presentation continues, whenever you may have a question.
Okay. Thank you, Dr. Gerkin. Let me just move forward again. This is healthcare literacy and contact tracing and its impact on life. Want to do that. Just little introductions. I'm Dr. James Wilson. I'm with GCC Counseling Department. I'm counseling faculty. And your moderator would be Dr. David Gerkin, who you just heard a little bit previously, also counseling faculty as well. Just a little bit for your convenience, this particular presentation contains a lot of information. There are slides that I won't cover in depth necessarily. I want to have you utilize this presentation and your PDF as a resource. I encourage students who I work with, as well as individuals I provide support and therapy to develop a resource library. And this is one of the presentations I think you may find useful to share with people you care about and love. So at the end, we will be placing a PDF into the chat box for you to be able to download. And I encourage you to download this information. Okay, so we're going to be starting, and I'd like to share with you a video first. This video is probably about 6 or 7, 8 minutes long. But I think you'll find it informative.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
Okay. Well, I take baby aspirin. That's something new. Cyclosporin, prednisone.
I took one pill, and I didn't even look at the bottle. I figured it was just, you know, a pain-killing pill. And half an hour later, I took another one, and then an hour later, I took another one. I kept taking them. I didn't have no idea how many pills to take. The only thing I know, the doctor told me to take those pills that would stop the pain.
Vitamin D, Nexium, Norvasc, Colestid, Estratest.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
Lipitor, Paxil, Darvocet, vitamin E.
If I'm really embarrassed or confused or worried about things around me, or worried about my child being all upset, I would not be able to read things I normally would read every day.
You know, some of the words that the angiogram, plasty, and all of that. What is that? Several things or one thing, or it's just a language that I'm not familiar with.
If the patient was transferred to that facility and to any and all
insurance companies or other third parties paying or obligated to pay. This is not making any sense. Tums, Tegretol, Tenormin, sodium bicarb, Cardera.
When I wake up in the morning, I have a small breakfast, and then I take my pills. I usually take 16 every morning. And sometimes it's difficult for me to take these pills because if they say one tablet twice daily, I don't know if they're talking take one in the morning, one in the evening, or take one in the afternoon or one in the evening. So usually what I do is take 2 of them in the morning. Then this way I know I have them in my system.
Take one capsule.
That's right. One capsule.
One capsule. I don't know what this is.
Twice?
Twice daily.
Okay. So how would you take this?
When I see it's not on, I tell you how to take it. It says take it twice daily, but it don't say what time to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4. Okay.
I would give her the 4 to 5, a tablespoon and a half.
In fact, she ran out of her high blood pressure medicine, so she didn't take it. She didn't call me to tell me to fill it. So finally I found out that she had not been taking it. I said, Mother, you can't do that. You have to keep taking that high blood pressure medicine.
Went to the doctor because my allergy was bothering me. So he prescribed some pills for me. And I went home and I took the second one. I started to cold sweat and my heart started to pumping real fast. So I was scared. So I called my daughter and to tell her what was going on because my daughter, she's a nurse. So she came into the house and she read and she told me the reason I was feeling like that was because the prescription that I took had some antihistamine in it. And that was right, the reason that my heart was going so fast and I was feeling the way I was feeling. And for the simple, it's like this cold medicine here. Cold medicine here, not even with my glasses on, I can read these labels. There's so small print, it's hard for a person to read it.
What do you take that medicine for?
Don't ask me. He puts me on there, and I just take it.
Okay.
Anything he tells me to take, I'll take it.
Okay. So you trust him?
Oh, you better believe it with my life.
Okay.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered?
Mm-hmm.
Hypered.
Like you're hyper?
Mm-hmm.
What does being hyper mean to you?
That's just where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, you know.
Okay. But you know you have high blood pressure.
Mm-hmm.
Okay, but hypertension doesn't mean the same to you.
Mm-hmm.
So if I ask you if you have hypertension, you're going to just think I think you're jumping around on the chair or something like that, something different.
Just being hypered, you know.
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
Yeah.
They're talking about problems.
Mm-hmm.
Can you see what this has?
And once for every 100 to 1,000 doses.
Mm-hmm. Is that helpful?
No.
Okay. What about this?
Once for every 1,750 doses. No, that doesn't even make sense.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
Well, my adventures with the cough syrup is wanting to know which one is best for me. So when I go to the pharmacist, I have to get advice from the pharmacy of which one it would be appropriate for me to take. You notice this one says Tussin cough syrup, and this one is a Tussin CT and a Tussin PE. So when, like I said before, I have to go to the pharmacist, tell him what my symptoms are, and he has to say which one is best for me.
My calcium spray, nystatin, Aricept, Lasix, Ambien, Imodium when you need it, and vitamin D. I believe that's it.
So I have a question for you. That video will be available as part of the PDF, and I encourage you, if you're coming in late, to take a look at that. It's informative. What is health literacy? I'd like you to just take a moment and respond in the chat. What is health literacy in your understanding? Just take a minute, and then I'll respond to what you say, and we'll move forward.
Take a minute to think about that and enter your responses in the chat. If you haven't used Zoom before, just open the chat by clicking once where it says chat on the bottom of your screen at the control bar, and type in your brief answer, and I'll be sharing those with Dr. Wilson. Okay, see one response. I'll give you a few more seconds to finish typing your other responses. Good, there comes another one.
Okay, great.
I'll give a few more seconds. Okay, one response says that I feel like I know what it means, but it's hard to describe it. I know what that feels like. I feel like that about lots of terminology.
Definitely.
Another one says understanding health-related directions and being able to read directions provided from a health provider.
Okay, all right, two good responses. Let me move on. Let's look at a definition of what is health literacy. There is a personal health literacy definition, as well as one that applies to organizational health literacy as well. Forgive me, I'll read this. Health literacy is the degree to which individuals have the ability to find, understand, use information and services to inform health-related decisions and actions for themselves as well as others. Organizational health literacy really is what's put in place in terms of policies and procedures and protocols from an organization to help you achieve personal health literacy. So that's the definition of organizational health literacy. It really is to support person. So let me move. Another question for you, health literacy. Who is responsible for improving health literacy? I just shared with you that some organizations are responsible for that, but who is responsible for improving health literacy? Let's take another minute and have you respond in the chat.
Okay, they're starting to come in.
Okay.
Okay, I'll give you a few more seconds if anybody else wants to respond in the chat. Okay, here's what we have is all of us, patient, provider, maybe even educators.
Okay, excellent response. Okay, let me move on. Before I respond to that, let me talk about the problem, first of all. I'll give you a few statistics around it. Only 12% of adults have proficient health literacy. This was the result of a national assessment of adult literacy in 2003. One of the things that has not occurred as often as it certainly should have has been a national assessment on adult literacy. The last major one was done in 2003. There's been smaller kind of samplings, but nothing that looked nationally. Also, there was an international assessment that was done in 2011 through 2013, and that found that 12.9% of adults have proficient literacy. We're looking there at reading, numeracy, digital problem solving, and that. In other words, 2 out of 5 adults lack the skills, manage their health, and prevent disease adequately. 21% of adults in that particular international assessment that was done, and we consider an adult anyone who's emancipated at 16 to 65 years old. That's what they looked at. They found that 43 million people, and this is in the United States, international assessment was looking at America, at low English literacy. This particular chart is just kind of a representation of that. If you look to the left, you'll see that the blue on the chart indicates low literacy, and this is by the millions. That's 8.2, 8.4, and then if you'll look to the right, you'll see that the gray bars will indicate mid to high English literacy as we go through this distribution. Just want to share this with you so you get a sense of what the findings were. Now, this was what was used by the Department of Education in some of its data in 2019. This particular slide looks at low literacy, English literacy in adults who were born in the United States, if you look at the bottom left of your slide, and then those who were born outside of the United States. And this breaks it down by white, Black, Hispanic, and other race. And if you'll look at the 45-degree horizontal bar to the left, for white, you'll see that 33% of those who were born in the United States, in contrast to 2% of those who were born outside of the United States, have low English literacy. And with Blacks, 20% with low English literacy and 3% who were born outside of the United States. But what you'll notice if you look to the right with the blue is that 10% of Hispanics born in the United States have low English literacy, in contrast to 24% of Hispanics who were born outside of the United States, those who've immigrated to the country. Hence, there's part of the reason we have ESL or English language learning programs to assist people who do come into the country. And then you'll see with the last one is 3% of others. Just a little more information about this problem. What we know is that health literacy is important because without health literacy, we see an increase in mistakes in terms of healthcare, people receiving the care they need, and we see a decrease in quality. If you look at this chart to the right, toward the bottom right, you'll see those arrows, the yellow one going up, white one going down. Also, what we know is that for someone who has low literacy, their annual healthcare costs is much more, in this case, $13,000 compared to only $3,000 for those with high literacy levels. This was what was found in that national assessment in 2003. Some additional information as well. In a study, there were patients who were given 5 pill bottles. And if you had a chance to see some of the video, you saw some of this play out. 50% did not understand at least one of the labels. 10th grade is the average reading level of health communication material that's put out to the public and to patients. And as you saw, 5th grade, the reading level of 30 million Americans, that has increased. That was 2003. That has increased now to about 43 million Americans who are reading at this level or below. One of the responses to this problem was from a company called Health Literacy Innovations. They have a health literacy advisor. It's a program, essentially, application developed that will help to bring down medical language to an understandable level. Here's an example. Look at the first sentence, the one with the X. I'll read that. Stage or malignancy, we need to perform diagnostic scans. And once we know the etiology, we can discuss some of the various treatment options. This program will bring that down into more understandable language where you see the check, you have cancer. I need to know where it has spread. A CAT scan should tell us. Then we'll know if drugs can stop it. There's a huge difference there in terms of the language and certainly the understanding that would be taken away from a patient. This particular slide is a screenshot of the Health Literacy Innovations. If you'll see at the top, there is a link, and I've made that link active. So when you download the PDF, you're able to click on that and get to this particular website. But they provide products that will help break down, if you will, this complicated medical language to an understandable level. They do sell to individuals, but you'll may be surprised to find out that their biggest customers are actually insurance plans or agencies, et cetera, that they use this software in order to break down some of the information they're trying to provide the patient. I encourage you to explore this. It's interesting. For an individual subscription to this on one personal computer, PC, I think they have an application for Apple as well. It's about $500 for a year. I asked the question, who is responsible for improving health literacy? And you were right in your response. Healthcare providers, all of us, healthcare providers, of course, if you don't happen to know, that means anyone providing care services. That can be your doctor, it can be a dentist, it can be someone even providing behavioral health services. Public health professionals that we see, such as Dr. Fauci, that we see many times, and others. Health policymakers are responsible for that as well. Those who are developing, if you will, the rules, the policies and procedures. Health administrators for these insurance plans, as well as other agencies. And then ultimately, healthcare consumer, we are responsible for improving our literacy. I want to share with you just briefly, there's some key health literacy research that has taken place. I won't cover all of this, read all of this, but I want to point out a couple of things. It's important not to blame an individual for not understanding the information that they're receiving from a healthcare provider if that information is not clear and made understandable. Direct, simple, brief, and understandable. And we know that even people who have significant education are at risk for misunderstanding information if they are emotionally charged or if the information is complex. Just a little further up, one more thing. It's increasingly difficult during now in this particular environment for people to separate, because they're working in a virtual world, evidence-based information, especially online, from misleading ads and gimmicks. So that becomes a challenge in itself. Who is at risk? And this is more rhetorical, but I wanted to ask, who is at risk because of low literacy? We saw some of an example of that in the video: older adults, racial and ethnic minorities, and then people who may have less than a high school diploma or GED. And we also find that low-income people with low-income levels are at risk. Non-native speakers of English are at risk. And then people with compromised health status sometimes aren't able to really attend and pay attention, if you will, in these situations where They're communicating very complex information, emotionally charged information. So people with compromised health status is also a part of that at-risk group. Another question I'd like you to respond to in the chat: why is health literacy important? I know this seems self-evident, of course, based on what we've been talking about, but share just briefly, or just take a moment. Why is health literacy important? Please respond in it.
So just whatever you think here can be from something you've heard in the presentation or just why you personally think it is important. So I'll give you another 30, 40 seconds to type in a word or two here.
I see we're getting some response.
Yeah, we're getting 3 or 4 responses. Give about 10 more seconds if someone's still writing.
Okay.
Okay, so Dr. Wilson, what I have is self-esteem, cost, outcomes, personal as well as societal outcomes, being able to maintain good health and communicate with healthcare providers. And I think of a woman who felt stupid after having, I assume that means after having to deal with a lot of health information that she may not have understood.
Right. That was a woman who signed off to have a hysterectomy done.
Oh, that's right. That's what she's now clarifying. That's
Right.
who she was referring to. You're correct.
You're absolutely right. Right. Who did that? Okay. Anything else, Dr. Gerkin?
No, that's all of the responses that we got from several different people.
Okay, excellent responses, and those definitely touch on it. Let me share some additional information why it's important. We know that people who lack health literacy report their health as poor, 42%. There's a tendency to certainly report that. 28% of those with low health literacy also lack insurance. They don't understand necessarily the importance of having insurance that will provide access to services and resources. We know that it's linked to poor health outcomes, which you mentioned, and you're absolutely correct. And of course, higher rates of hospitalization occur because people use less preventive kind of services and take less preventive action with regard to their health. The outcomes are associated, all of those, with higher healthcare costs overall. Here are 5 reasons why I think health literacy is important as well. Just to add to that, health is wealth. You can't, once you lose it, it's gone. You can't get it back at the level you initially had it. Of course, disease prevention, ounce of prevention is worth a pound of cure in this respect. And then self-advocacy, which is critical in the healthcare system, being able to ask for what you need and advocate for that. And it does reduce healthcare costs, personal costs, as well as systemic costs. When you think of those chronic diseases like diabetes, heart disease, cancer, as well as mental health issues, mental health illnesses, all those drive up healthcare costs for everyone. And also, it may reduce the negative effects of any kind of healthcare system disruption. If you just think recently, the Affordable Care Act, the ACA was for the Supreme Court. If that had been struck down, then we're looking at immediately 21 million plus people without health care at that point, needing to try and figure out what they're going to do. I want to share with you how health literacy is measured, how it's done. And this is how it was done in the National Assessment Survey. They look at 3 domains in which they're measuring and assessing. The first is a clinical domain, and that's how well a patient can fill out forms. I just recently had to go to the dentist for multiple root canals. to my primary provider and its provider, as well as to a specialist to do the root canals. And there were tons of forms there that I had to wade through. And I made sure, because I'm aware of this, to ask for clarification for anything I didn't understand as I was filling that out, and what that meant in terms of cost or treatment. Also prevention, what's assessed. How well are you able to follow the guidelines? We see, unfortunately, diabetics, people with diabetic diagnosis are notoriously known for not being able to manage their blood sugar, what they're eating in that sense. So it's really difficult for providers to manage certain kind of problems like diabetes. Sometimes asthma becomes a problem. There are other kind of problems, gastrointestinal problems, etc. Navigation of the healthcare system is also the one thing that is measured. Understanding a health insurance plan, how to pay for it, how to get it, where to access services as a result in the healthcare system, where you need to go. The results of that assessment of those three domains, this is what that looks like, what it means. You're proficient if you're able to handle the complex and challenging literacy activities. Take, for instance, the example of the communication at the health innovation literacy application would reduce down to an understandable level. That would be complex communication. Intermediate, moderately challenging literacy activities can really handle things and understand most paperwork. Would need to probably ask for clarification on the more complicated things. But then we get to, if you look, the basic, simple, everyday literacy activities can get over the counter kind of medications and understand how to take, I need to take the cough syrup 3 times in a day, 1 teaspoon 3 times a day. They're able to interpret that. But then below basic is what we saw in the movie, in the video to some degree. And this is the most simple and concrete literacy activities are challenging and the person struggles with that. And then of course, individuals who are non-literate in English are unable to really do the minimum. In this particular assessment, they were unable even to complete the screening or task. They could not be effectively tested. I want to point out as well that health literacy online is important now that we're in the virtual world, predominantly communicating. And what we know is that with limited literary skills, that people have problems with short-term and working memory. They struggle with that. Also, we know that if there's a large amount of information or content on the page, that users may not be able to remember all of that. They struggle with that. Also, there's a tendency to choose the first answer that the person will find and without checking it's correct. And so it's difficult for someone with low literacy skills to distinguish between high quality and low quality information online and internet. And then it's difficult for them to recover from mistakes that they may make in just literally trying to access that information, trying to click on links, etc. Continuation of that, also we find that with limited literacy skills, people tend to spend more time on search tasks, looking for information. There's a tendency to give up quickly if that information isn't found. And then also there's a hard time thinking of search terms. What would I use to try to find information on this particular subject? And to click on 1 or 2 links in a search result versus really being more thorough. And then the average time spent on a page is usually about 15 seconds or less. Many people with low literacy skills. So I would like for you to take a poll. Rate your health literacy. How do you rate your health literacy or the health literacy of someone that you love? I want you to think of yourself, or you can use someone in your life that you love. And the poll is going to come up. I'm going to give you a moment to respond to that. And we're using those categories of proficient, intermediate, basic, and below basic, and non-literate in English.
Dr. Wilson?
Yes.
You wanted me to remind you when it was 35 minutes. It's 36 minutes now into the workshop. Are you seeing the poll?
I am seeing the poll.
Okay, good. I see some responses here.
Okay, great.
I see one response so far. So I'll
Okay,
wait for a few
100%.
more.
Okay, proficient. That's excellent.
So go ahead and make your choice on the poll: proficient, intermediate, basic, below basic, or non-literate English. Click on one of those. And if you don't see the poll, type that into chat and let me know.
Okay, it looks like.
Don't see any other answers yet, so I'll give a few more seconds here.
Okay. And for those of you who would view this later, I would also ask you to rate your own health literacy, or those of someone that you care about or know.
Okay, for whatever reason, I'm not seeing any more responses, so I'm going to go ahead and end the poll so we can move on.
Okay.
And sharing the results, which we've already seen. We had one response that was proficient. So I'm going to stop sharing the poll, and then you will need to click on the little red dot in the upper left-hand corner of the poll to close it and remove it from your screen. So if you'd please do that now.
Okay. Well,
okay, go ahead.
Okay. Thank you, Dr. Gerkin. And thank you for that one response with that of your proficient. And I am speaking to the choir, and I really encourage you to help others become literate as well. Let's move forward. I also just want to share a little information: mental health literacy. We think of literacy, of course, in other domains, but this is one: mental health literacy and suicide. Just want to share a little information with some statistics. The American Association of Suicidology responded to 13 Reasons Why, which was a Netflix movie that looked at teenage suicide and the reasons for that. Here's some of the information that they wanted to put out to the public as a result of that particular Netflix movie, in order to make sure people were adequately informed. Over 120 Americans die from suicide daily. 15 are young people between the ages of 15 and 24. One of the things that they also put out that I think is important is that direct non-judgmental conversations with people, young people, talking to them about mental health and suicide, hope, as well as recovery, have a positive effect that lasts throughout that person's lifetime. And everyone in the community can participate, can be someone who can help someone save their life by sharing that kind of message. We also think it's important, and they do as well, that news media puts out information, spreads the message so that young people have an opportunity to not only be informed, but their parents and those that they're connected to. And also we've included here the National Suicide Hotline. That has a lifeline chat. You see the number there, and it's available 24/7, as well as there is a text crisis line, text talk 741-741, that's available 24/7 as well.
Just a reminder, we're going to post these slides as a PDF file at the end of the session, so you'll be able to click on all of these links and get all these phone numbers and any information that you might want.
Thank you, Dr. Gerkin. Yes, just also I included just a little information about what the facts and figures are here regarding suicide in Arizona. I won't read this for you, but I want to make this available. I'll point out a couple of things. On average, one person died by suicide every 6 hours in the state of Arizona. And then also it's the 8th leading cause of death in the state of Arizona, and it's the 2nd leading cause of death for ages 10 to 34. Taking action now and going forward, certainly This is information that can be shared. I want to encourage you to help improve literacy in yourself and the people you know. We all need to continue learning more and more as new therapies come out and new fields are broadened in terms of providing care. We need to educate ourselves. Also, I want to make you aware of a patient navigator program. If your insurance provider and healthcare provider doesn't have one, a patient navigator simply is a health professional or community health worker who will help patients evaluate their treatment options, obtain referrals, find clinical trials, and then apply for financial assistance as well as other resources. This is just a few of the resources. In 2005, Congress passed the Patient Navigator Outreach and Chronic Disease Prevention Act, and it was done in a bipartisan way. It was something that was believed was important by all parties there. Also, the Patient Protection and Affordable Care Act, Public Law 111-148, formalized this. This was about March of 2010, formalized, strengthened the Patient Navigators Act. It was passed in 2005. And essentially, what it did was to require an establishment of a navigator program to help individuals as well as businesses. And this is for the health exchange that was created at the time the Affordable Care Act came into existence. Just below that, I want to point out for those of you who may have veterans in your family or be family members, be a veteran yourself, that in Arizona, there is a navigator program training and service and resource just for veterans. There's been over 4,800 Arizonans who have participated in that training. It's open to anyone in the community who would like to do that. And that's part of a Be Connected program to help individuals who are veterans or their families connect to resources and services in the community. I encourage you, this will also be in the PDF. I encourage you to certainly click the link and explore those resources. And if you're interested in eventually getting trained as a navigator, helping veterans. Wanted to share with you just a little information. Patient Bill of Rights. What is a Patient Bill of Rights? This is a consumer bill of rights and responsibilities that was adopted by the U.S. Advisory Commission on Consumer Protection and Quality Healthcare in 1998. It's been known typically, if you've heard this phrase, the Patient Bill of Rights, and this is what is being referenced with that. I provided some information for you for your resources. I'm not going to read all this, but I just want to point out that there were three major goals with this Patient Bill of Rights. The first was really to help U.S. consumers feel more confident in the healthcare they're receiving, as well as, if you look at number two, to really emphasize the importance of that patient-provider relationship, doctor relationship, or therapist relationship. And also to stress the key role that a consumer has in playing in their staying healthy as part of receiving treatment in healthcare. So there are responsibilities to that. Also, this Bill of Rights has been adopted by many insurance plans offered to federal employees, but also through Medicare and Medicaid, which would mean in the state of Arizona, Access would really utilize this kind of protocol as well in terms of Bill of Rights for patients. There are 8 key areas to that patient's Bill of Rights. I won't read all this, but just to point out, there's information for patients that you have a right to get information that's easily understood and accurate to help you plan your health. You have a right to a choice of providers as well as different plans. You have a right to access emergency services if you feel that you are in danger, your health is in danger. With that, you have a right to take part in your treatment decisions, to be informed, and to make decisions about that. And to be treated also with respect as you receive services. Confidentiality, you have a right to that. Privacy of your health information, to talk to your provider privately. You have a right to be informed about any errors in your information, health information, and a right to change that information. You can get a copy of your medical records. You have a right to that and correct anything that might be an error or incomplete. You have a right to file complaints as part of this patient bill of rights in appeals. If you feel that you're not being treated fairly or you haven't been treated in a way that has been professional and competent, then you have a right to complain about that. And then there are also responsibilities as a consumer. You, of course, need to make sure that you're keeping your appointments, that you are that you're engaged in the kind of lifestyle behaviors that will contribute to you being healthy. There's an example here, for instance, exercising, not using tobacco, if you have issues with that. And so these are just the 8 key areas. I'll leave that for you as a resource to look at later. We are looking at 2 particular subjects in this presentation. The other is contact tracing and COVID-19 with this. So I'm going to move briefly. I know we don't have much time. If you'll notice Arizona Department of Health Services at the bottom of this particular slide, there is a link there to their database at the website, the dashboard that will provide you real-time information about COVID-19 in terms of hotspots by zip code, hospitalization rates with that, and unfortunately death rates, as well as level of infections, and looking at positivity rates. So I would encourage you to access that link. Next, I'd like to share with you just briefly, how does contact tracing work? And this is just about a 2-minute video, so this will be very brief.
COVID-19 continues to spread around the globe. You can help stop COVID-19 by participating in contact tracing. How does contact tracing work? Contact tracing is a system that has been used for decades to stop infectious diseases. A contact is anyone who has had direct physical contact or was within 1 meter for at least 15 minutes with an infected person, even if that person does not have symptoms. This applies to anyone who has had contact from 2 days before a person gets sick until 14 days afterwards, or from the 14 days when an asymptomatic case tested positive. Once you are confirmed as a contact, you will be asked to go into quarantine, which means to separate yourself from others and to monitor your health for any signs of illness. The monitoring ends on the 14th day from your last contact with the person infected with COVID-19. Quarantine can take place in a special facility outside of your home, or at home, if you can stay separated from family members. Why 14 days of quarantine? It can take from 1 to 14 days from contact with the virus to develop symptoms. During this time, you should stay in quarantine and monitor symptoms, and follow instructions given to you if you become symptomatic. Without contact tracing and quarantine, the virus will continue to spread. This leads to more people becoming sick and infecting the most vulnerable. By identifying and limiting contacts of people infected with COVID-19, the virus stops spreading and the community stays safe. To break the chains of transmission, we all need to work together. If you become sick with COVID-19, stay away from others. Follow the recommendations of your medical care provider and share the list of people who you came in close contact with. With your help, we can prevent further spread of the virus and save more people's lives. By acting together, we can break the chains of COVID-19 transmission. COVID-19 continues to spread.
Okay, I want to move forward with that. This particular slide has a link because we are seeing a lot of this contact tracing taking place in the virtual world through telephones, through online communication. There are guiding principles used for that digital and public health technologies, pandemic response. And that link is to that to tell you, to inform you as what to expect and how contact tracers will behave ethically in the job that they're doing with that. I want to move on just real quickly. We don't have much time, so I'm going to move quickly here. What is the difference between a sign and symptom? Let me have you give a quick response. If you want to go into the chat, I want to give you about 20, 30 seconds. If you wouldn't mind putting in a response. If you don't have one, that's fine.
Just type in one, just a few words, a short phrase is good.
Short phrase, very quickly.
Okay, got a couple responses, Dr. Wilson. One says that a sign indicates possibility, and another says that symptom is usually something associated with the actual disease.
Okay, interesting. Let me move forward with this. So I want to give you the definition of that because it can be confusing sometimes. A sign is the effect of the health problem that can be observed by someone else. This is what a person outside of you can observe, your doctor or someone that you're close to sees this. A symptom is an effect that's noticed and experienced by the person who has the condition. Those are the official definitions. I'll move on. There are three types of symptoms that we see. Remitting symptoms, these are symptoms that resolve completely. They're known as remitting symptoms. If someone had a symptom and it goes away completely. And then there are chronic symptoms that are long lasting and recurrent. Of course, an example of this is diabetes or asthma, cancer. They continue to impact the person. And relapsing symptoms, depression is a good example of that. Someone may have had depression at one time, they've gotten over the depression, then something causes them to experience depression again. The types of information collected through contact tracing, they want to collect this information about signs and symptoms in the course of illness. It's important to have that information for public health professionals to be able to make decisions to inform healthcare providers as well as the general public about where there may be hotspots or uptick in cases. Types of information on this particular slide, specific signs and symptoms. When we look at individuals who are COVID positive, they want to know the relative frequency, durations, and of the different signs and symptoms. For persons with no symptoms, but who test positive, they're interested in that information that they're collecting, as well as pre-symptomatic individuals and individuals who are post-symptomatic as well, and then as well as a person who never manifests illness. They don't test positive and they never have any signs or symptoms. Even though they may have been somewhere where someone eventually reported someone was COVID positive themselves. There are some different ways that people respond. Everyone is affected a little differently, but most people will develop mild to moderate illness and recover without hospitalization. But these are some of the most common symptoms you see and less common symptoms. I would just go through these, but I just want to make you aware of these and you can access these later. The serious symptoms I want to mention here, if you see any new confusion, inability to stay awake or stay awake, bluish lips or face, issues with that circulation, then a person should seek immediate care. Always call ahead, whether it's an emergency room or your provider's office, a PCP. And on average, it takes 5 to 6 days when a person is infected with the virus to show symptoms. However, it can take up, as you saw in the video briefly, up to 14 days. I want to just ask you very quickly here, one question. Take a look at this poster, if you would. This is Help Stop the Spread. What recommendation is missing from this poster? I want to give you about 20, 30 seconds and then just a quick response in the chat.
It's kind of small, so I'll read the major headings if you can't
Sure.
read it. Avoid close contact, stay home when you're sick, cover your mouth and nose, clean your hands, avoid touching your eyes, nose, or mouth, practice other good health habits like cleaning and disinfecting, getting enough sleep, and eating nutritiously. So what is missing that you should do to help stop the spread? If you see anything missing, type it in. Okay, Marcia says mask.
All right, we'll move forward. Marcia, you're absolutely correct. Mask. And I just put in here some information about how do you choose a good mask and what not to choose, what to watch out for adults, as well as I also included information that looks at children, special situations, gate tears or face shields. There's still some controversy about that. So you want to be cautious with those. And then, of course, wearing glasses, some information. We all know if you wear glasses and you have a mask that will fog up on you, excuse me. We're almost out of time, but just briefly, I wanted to share with you the negative impact financially and mentally that this pandemic has had on individuals in the country. Here I have it broken down into Black, Hispanic, and white, and you can see people who have lost jobs, people who can't pay for basic necessities, the impact on mental health, and people who know someone who has died from this virus. So it's a significant percentage of Americans who have been impacted by this. Finally, I want to share with you. This is a screenshot of the Johns Hopkins University contact tracing educational page, so to speak. This is where, if you go to this particular link page, you can receive contact tracing training. It's free. It's a 7-hour course. You are certified after successfully completing the course. There's a exam that you have to pass at 80%, but this is free. There's been over 1 million people trained in this. Contact tracers are desperately needed. In Arizona alone, I think there was, the last time I looked at that, there were a need for 4,000 contact tracers to be trained to contact trace here in the state. Department of Health Services on their website also will provide access to training that they provide. Contact tracers are paid for this, and they do this typically from home, either by computer or telephone. You're not actually going out and talking to people face to face. But this is something that's one of the mitigating factors that's very important, right? Washing your hands, keeping the appropriate distance not getting in large groups, wearing a mask, okay? And then this becomes an integral component of that mitigation complex to make sure that we're able to damp down this virus. So let me ask you questions. Thank you for staying with me with this. If you have any questions, I will remain for a while, and certainly I look forward to answering anything. If not, please stay if you happen to be here and you need extra credits. We'll share with you how you can get that. The PDF for this particular presentation will also be loaded into the chat. Yes. So hang on, go ahead, Dr. Gerkin.
So before you go, if you want all those slides and all that information and all those links and phone numbers, I am in the process of loading that file for you that will have all the slides. So just give me a couple of seconds and you should see it appearing in the chat. Okay, it's loading in the chat right now. So if you would just type in when you see it, let me know. Also, it'd be a good idea to download it, open it up, make sure that it looks like it works, like you can go from one screen to the next. So I got a message that you can see it. A couple of messages they can see it. If someone has time, if you download it, let me know that there's about 52 slides there. You can kind of quickly go through and look like it, tell me if it looks like it's all there, because yesterday or the other day I had a workshop and they downloaded the file and it was only the first screen. Oh, so if anyone has time to check, that would be helpful. If you don't, that's fine too. And if you are here, for example, English 101, Math 242 extra credit, give us that name of that class, that instructor's name. If you're here as for extra credit for honors or for nursing or whatever program you're in, give us that information so we can let the person in charge or your professor know that you were here and you can get the extra credit. You don't need to write your email. For proof of attendance, we have your name. If you do give us your instructor's name, the letter of the class, for example, ENG 101, the course prefix we call that, or honors program, Excel program, ACE program, if it's a program. But if it's a class, please give us the class and the professor's name, then we can get that information to that person.
And I just want to thank you for participating in this. I encourage you to share this information if you think it's valuable for someone you know.
I'm going to stop the recording just so you know you'll hear that recorded message again, but you can stay logged in if you like.
Let me go to the next slide, Dr. Gerkin, just real briefly. Also, we do have a couple of links we want to make you aware of. One is our website link for all the workshops. There's been, I think, 5 or 6. This will be the 5th or 6th one. And then there's also a link to your YouTube page where eventually this will be uploaded as well and be available to you. Thank you, Dr. Gerkin.
Okay, I'll stop the recording.